Introduction to the Psychotropic Medicines in Cognitive Disability or Impairment Clinical Care Standard. People living with cognitive disability or impairment are valuable members of our community. They include older people living with dementia and people with neurodevelopmental disorders like intellectual disability or autism. Psychotropic medicines are often prescribed to these groups of people, either for mental health conditions or for behaviours of concern, also known as challenging or changed behaviours, including aggression, agitation, and sometimes self-harm. When medicines are prescribed for the main purpose of influencing or controlling a person's behaviour, this is a restrictive practice for which there are safeguards in place. Psychotropic medicines have a role to play in the care of many people, and prescribing may be very appropriate. However, research evidence and 2 royal commissions have shown that these medicines are widely used in older people and people with disability, often without informed consent, for prolonged periods of time, and without appropriate monitoring for effectiveness and adverse effects. The standard aims to improve care for people who have a cognitive disability or impairment, whenever and wherever they receive healthcare. It focuses on 8 priority areas where improvements will help to reduce and potentially eliminate the inappropriate use of psychotropic medicines in these particularly at-risk populations. 3 elements of the standard apply when a person has behaviours of concern. Firstly, the standard says to identify possible causes of the behaviour through comprehensive assessment. Don't assume the issue is due to the person's impairment. Next, always use non-medication strategies as the primary method for preventing and addressing behaviours of concern, even when medicines are considered appropriate. And thirdly, use a well-developed behaviour support plan to guide management and refer to the person's plan if you have not seen them before. The remaining elements of the standard apply whenever psychotropic medicines are being prescribed for any person with cognitive disability or impairment, regardless of the reason. Importantly, support informed consent. Discuss the risks and benefits of the medicine in a way that the person and other decision makers can understand. Use medicines only when there is a clear reason, and document this for other healthcare providers. Monitor and review medicines regularly to check for side effects and to make sure they are working as intended. Where there is no benefit, stop the medicines. It is essential that the person's preferences, needs and values are considered at all times. And as healthcare workers, we make sure that information about the person's care plan, including any psychotropic medicines, are shared effectively at transitions of care. Working together, we can improve the health and well-being of people with cognitive disability or impairment and reduce the use of these high-risk medicines. This standard is endorsed by the Aged Care Quality and Safety Commission and the NDIS Quality and Safeguards Commission, as well as more than 20 professional organisations and peak bodies. You can learn more about the standard and the supporting resources on our website.